Paulette Dalside is a dental hygienist. Last week, she was working with the Métis Nation of Alberta to provide dental services in Cold Lake, Alberta, which is in the MNA's Region 2.
Our Métis citizens are traveling 3, 4, 5 hours to be able to access these sort of really tailored, meeting our distinct needs sort of environments. And so the community overall, you keep hearing the same thing over again. When is this happening again? How do we make this happen again? You know, these services are so needed.
Services like getting a tooth filled or a good tooth cleaning.
Having a clinic like this that comes into our community where the community can then wrap around and create this holistic, really community-driven, safe atmosphere, it means a world of change for so many people.
Is joining us on this trip.
Adam McCourt is a fourth-year dental student. He is part of the Access for All mobile dental clinic at the University of Alberta.
We did our trip in Lac La Biche in the fall, so in November. That was also a week long, and that was our first trip that we had done. We called it a pilot trip. There's still lots to learn, so I think we're going to call this one a pilot trip too, but it's been going really well. Comparing it to Lac La Biche, we added an operatory now that we're a little more organized and have things figured out. So we've been able to see more patients this week, and it's been amazing.
And it wasn't just dental work. There were activities, jigging in the evenings, and more. It offered a chance to catch up with friends and have fun. Reagan Bartel is the Director of Health for the Métis Nation of Alberta. She says this clinic was another success and that it proves that the MNA can be a self-government.
So the other thing about this clinic is that it is evidence that the Métis Nation can take care of themselves. So when we're given the capacity, be it prioritization or funding, our federal partners, our provincial partners need to look at these clinics as models for the way that Métis people can govern and self-determine their own health priorities.
Kirk Johnson says his brother warned him that getting a filling was going to hurt.
I was a bit anxious at first, but once I got in there and they started doing it, I was fine, and all the anxiety went away. I could thank Paulette and the two dentists in there that did the filling of my tooth and the Métis community.
Over 85 people were treated during the week-long clinic. More clinics are scheduled to be run in November. Chris Stewart, APTN National News, Cold Lake, Alberta.